Welcome, moms and expectant parents. This is Dr. Michelle Doherty, and I'm joining you virtually. And I'm so thrilled to be able to present Delivered to You, just really empowering you through a journey so you can achieve your best birth and, of course, everything that follows beyond. So I wanted to just go ahead and share my screen with you. Here we go. Awesome. Okay. So the one thing I want to make clear is what this presentation is not about. This is not to tell you what you should do. It's merely to present options, let you know things that you may not know that's out there, but also ultimately making sure that we're protecting your headspace. Again, this is your birth, your journey. You need to be able to vocalize what it is that you want and surround yourself with people that are going to support you through this process. The one great analogy is that birth is like the wedding, planning the ceremony and the reception. The real work happens after birth, marriage itself. So we need to make sure that we have good footing so we can continue with the best path forward. All right, hopefully this will continue to work here. All right. All right, so just a little bit about me. I'm a prenatal and pediatric chiropractor in Naperville, Illinois, and I'm so proud to be able to serve so many families and hearing great stories about births and the outcomes. The reason that we do this is because in the past, it's always been a struggle to work with a mom who has been completely stressed out or maybe didn't have the birth that she wanted, and this stress obviously continues to follow her. And as we know now, mom and baby share stress hormones. So these babies are becoming more wired for stress, and we care for a lot of families, and we want to obviously help avoid complications from labor and delivery and the ensuing results of a perfect storm, which we will cover here. So we want to empower moms to not only have their best birth, but also have the healthiest and happiest babies, so we can have a generation that is strong and healthy and empowered and is going to become our future leaders. So it really does start with the building blocks. So our vision, of course, is to ensure that women can prepare their bodies and minds for birth so that they can be their best when the moment does arrive. And so their newborn child takes his or her first breath in a way that allows them to develop as a healthy and happy child. This is what we want for all of our kids. So we broke down this presentation into, let's see if I can move myself here, into 4 major categories. We want to educate, exploring the effects of current birth trends, empowering to shift towards your ideal birth, encourage, letting you know what it's going to take to choose your team and encourage you to take the wheel. And finally, enhance, doing what you can and being proactive to transform your pregnancy and birth. There we go. All right. So in order to educate yourselves about all the options that are out there, we have to look at what the current trends are. We have to know where we're starting from so we can make changes moving forward. So whether this was a planned birth or not, I mean, first off, congratulations. I mean, this is a big thing. It's a big deal. Some of you may have struggled to get to this point. Others, it may have just fallen easily into your lap. And for some of you, maybe there is a little bit of fear because this wasn't exactly the timing you were planning for. But just know that it'll all be okay in the end, but planning is key. But what did you actually envision when you pictured a typical pregnancy in the US? Do you think about like Hollywood movies and how that all goes down? I mean, what are the first thoughts? And granted, usually when we do this live, we're able to engage, but are you thinking about the woman screaming with her legs strapped and, praying for it to be over and being awful to her partner? Or do you envision something that is more blissful and relaxing and calm and peaceful? I mean, we all have our different visions of what currently is, or maybe perhaps what you're looking for and what you want. And what does your ideal birth look like? You know, is it the same? Is it different? Does it involve any of these that you see on the screen here? You know, is it something that you're planning, whether it's at the hospital or in the birthing center or maybe at home with a certified birthing midwife? It can be different. They're all great. They all have their place. So what are you going to do to support yourself for success and to lead you through the process? Currently, 80% of all births are augmented in some fashion. So what do we mean by that? Altered, intervened. So we're always taking a chance when we are obstructing what the body is naturally trying to do, or by stopping a process that's trying to happen. So these are just some examples of what augmentation looks like. It's not always just C-section. Epidurals, of course, episiotomies, the use of forceps and vacuum. When births stall out in the birthing community, that's called dystocia, so it's a failure to progress. Then we need to use interventions like Pitocin. Sometimes it's a mechanical dilator. Sometimes we will apply something to the cervix to help ripen and move things along. And sometimes we're just rupturing the membranes. And that can be due to a whole host of things. If you are in a hospital setting, there's some rules and regulations to abide by. For some, it could be the advanced maternal age, which, I have some qualms with that. We know that women are well into their late 30s and early 40s able to have successful and healthy births. So just know that there is another way, because the one question I don't want you leaving with on the other side is, I wish someone would have told me, or no one told me that you could do it this way. Okay, so there are some risks, as we know, but thank goodness these interventions do exist, because there is a time and place, and we recognize it and we do honor it. But just for example, with getting induced, most commonly with Pitocin, it has been shown that it can decrease fetal heart rate. It can make contractions longer and harder, because you're basically going from 0 to 60, whereas when your body's naturally able to do it, it's a slow progression and your body's able to adapt more easily. You're 2 times more likely to end in a C-section, and a higher probability of an epidural. So you can see that there's a cascade of this intervention train that can ensue. And then toward the end, reduced rate of infant breastfeeding. So for some women, they want to maybe get through this process, but ultimately they want to be able to nurse and have that type of bonding and nutrition and all of the other benefits that come from nursing. So we know that this is another possibility. So some results or risks when it comes to an epidural: longer labor times and more difficulty. It can actually start to slow things down. You're at 3 times the risk of a severe perineal tear, because part of it is once you have this, you're not able to leave the bed. You're not able to labor and birth in different positions that have been shown to help open up that pelvic outlet. You will be, confined to the bed, and you do the best that you can in those situations for sure. 4 times chance of a posterior presentation, so sunny side up. That can lead to a lot of hard back labor. It can be additionally painful in comparison to what's already going on. A higher probability of instrumentation, because we don't feel these contractions. It's hard to push in the right areas, and we end up pushing through our face, and an increased risk of pelvic problems. So we know that if things are in a more balanced state, things tend to work better. So the key is balance, and we know that a balanced nervous system is going to be able to communicate well with other parts of the body, including the uterus. Oxytocin, which stimulates contractions, is all happening up here. So we know that we have to be in a state of balance and peace, because there's nothing worse when it comes to labor than fear setting in, feeling stressed out, anxious. All of those things start to shut down those hormonal pathways to execute that vital sequence to initiate and progress labor. And Dr. Bruce Lipton, who is one of my favorite biologists out there, he quoted it so well: you can't be in growth and protection at the same time. It's like you trying to apply your foot on the gas pedal and the brake pedal at the same time. You get nowhere fast. So balance is definitely key, and there are ways to balance the central nervous system. So why all of this? Why are we even talking about this? Really, to acknowledge what's at stake. The current stats right now with our little ones, we know that about 1 in 4 have allergies. 1 in 10 children will develop asthma. 1 in 8 with ADHD, and 1 in 68 with autism. And of course, the rates of childhood obesity, type 2 diabetes, learning difficulties, anxiety, behavioral issues, all of these things are on the rise. And we know that what happens during the prenatal period, of course, we can't forget about preconception period. All of these are building blocks leading to this baby that's going to be born. And we know that life starts in utero. So it's not just what happens on the other side, but everything leading up to that point. Do you have a current plan right now? It doesn't matter if you just found out you're pregnant, you're well into your 2nd or 3rd trimester. It's never too late. Don't let anyone ever let you know that you don't have a choice. You always have a choice, but it's important to be prepared. And, I don't know about you, but I like the idea of my baby being born and birthing my baby versus my baby being just delivered. Because we want the control back in your hands and for you to take the wheel. So the road less traveled. It's not to say that one way to birth is better or worse than the other, but you just need to know the pros and cons of everything out there, and just know that you have choices and you can change and make decisions and do anything that you need to do so you feel at rest and you feel at ease, so that you can bring your baby safely into this world. So for some, it may look like prenatal exercise and yoga. Of course, staying active, we're going to touch on a lot of these points. Having a co-captain, like a prenatal chiropractor by your side, massage and acupuncture, having a doula, which is like the liaison for wherever you're birthing at, and that's going to be your #1 supporter. OB-GYNs, birthing centers, nutritionists, midwives, a birth class. And the key with the birth class too is you want the birth class to teach you what to expect and empower you so you know what tools you have on hand versus knowing how to be a good patient. That's what you don't want out of a birthing class. So the reason why a lot of women are exploring a more natural birth, more often than not, it's because they didn't have the first birth go the way that they wanted it to, or maybe they weren't prepared, or it left scars, physical, mental, emotional scars with them that they're still carrying with them now. And the last thing you want to do is, if you have those types of scars, that you're not carrying it through with progressive pregnancies. This is why people are looking for a way to connect with their own bodies. But the key is you need to stay in control of your birth plan. Share it with your partner, share it with a provider, put it out there. There's something to be said about when you actually write down your goals, that 3/4 of them, of the people who do that, actually achieve their goals. So you want to make it well known, but also just trusting in the natural process of your body. Women have been giving birth for a while now, So knowing that nature had it right, your body knows what to do. If it was able to get pregnant, it's going to be able to go through this process. Also, in a more natural setting and trusting the process, you're going to be more comfortable in a more comfortable delivery environment. Again, I can't emphasize enough how important it is to feel supported and in a state of ease during this most important time in your life. You're more likely to achieve your ideal plan, and with a more natural birth, there's less trauma and lower odds of C-section. And we understand stuff happens sometimes. Sometimes there's an emergency and they need to do interventions in order to save mom's life and baby's life. The 2 questions you should always ask yourself throughout the process is baby okay and am I okay? If so, continue with what you set out for yourself. It's been shown that there are lower risks of respiratory complications in a less intervened birth. When you have a more natural birth, and ideally, if you are able to have a vaginal birth, it's going to stimulate the cardiovascular system. It's going to push fluid out of the lungs. That's known as the first adjustment, if you will, is, you know, getting that life force in there. Naturally protective bacteria when you go through the vagina. If we need to go through a C-section, there you have an ability to request, and you should include it in your birth plan, to be able to swab for that bacteria and be able to put it in the mouth and nose and eyes of the baby so that they at least get some of that protective bacteria. Baby benefits from hormonal surges from these contractions, and they're at a 20% lower risk of type 1 diabetes. Non-hospital births are 4 times less likely to end in a C-section. And again, with the climate going on in our country right now, unfortunately, midwives that do home births are getting inundated more and more, again, because there's a lot of fear out there. So we need to make the best of our situations, and again, surround yourself with people who can be supportive, and it will all be okay in the end. Also, 84% of women who planned an out-of-hospital birth achieved their goal. Non-hospital births can actually still be covered by insurance, and they tend to be less expensive because there's fewer interventions. So that's a common misconception, that if you wanted to even have a home birth, that how could you afford it? There are many insurance plans that will cover at least a portion of it. So worth checking out just to know what your options are. So is your personal birth journey somewhere in between? And it is okay. All births are, I mean, whatever the best decision is for you is going to be the right decision, but you want to own it and feel good about it, and don't listen to anyone else, because ultimately what matters is what you and your partner decide. We're going to talk about taking the wheel. We're going to talk about knowing your options, and hopefully you'll come out of this with more confidence, so you feel like you got it, you are going to own and rock your birth. So we want to help build confidence so you can ask questions that lead to conversations of your birth. Never keep it to yourself. Don't feel like you're on an island. You want to converse and surround yourself with other expectant parents. And whether it is a birthing class or keeping very open lines of communication with your birth team, it's all going to be helpful. It's hard to navigate it alone. After all, it does take a village, right? So if you've ever heard the quote, if you want to go fast, go alone. If you want to go far, go together. And that is the philosophy that we have utilized here at Lifetime Health and Wellness, because it is easier to do bigger and better things together than to navigate alone. And the same goes for birth. Your birth team. Okay, so if you are the captain of your ship, who are you going to pick to support you through the process? The one thing that we're thankful for at Lifetime Health and Wellness is we do have resources. We are well connected with the community, especially the birthing community, where we have great relationships with OBs, with midwives and doulas and pediatricians and lactation consultants and acupuncturists and yoga instructors. The list goes on and on. It really does take a village to raise a child. And so knowing that, one, we don't do it all. We're the first to acknowledge that. But I'm so grateful to know the people who can also get the job done. And you should too. The mind-body connection is huge. We know that if we have a mind that's at ease, your physiology will follow. So that whole brain-body connection is very real, and we do have control over our thoughts. We have control over our choices. And so we want to make sure that we're creating the best environment so that this magical process can happen the way, ideally the way you want it to happen. So just again, a little bit about me. I have a 5-year-old currently, and I'd be lying if I said that we followed my birth plan like 100%. No, it did not happen exactly the way that we had planned for, but the number one thing that I have to say that was my saving grace, and that I hear a lot from our practice members, is the ability to adapt. How quickly can you pivot in a situation that is stressful? And then just knowing that in the end, we have to own what happens. We have to have peace with it and just know that it's not right or wrong. This was just your path and your journey. And there's always something to learn from these things. And it's hard and it's real and it's raw. But know that if you can adapt, if you can increase your resilience factor by having a great headspace and eating a nutrient-dense diet, feeding yourself in many ways to fill your cup, you will come out on the other side, feeling like you accomplished one of the coolest things ever. And that's what I want for everyone. I don't want to see more moms, struggling with the aftermath, unable to come out of it, losing their milk supply as soon as they get to work because they have still been stuck in this train of stress. So that's what I want for people. I was able to accomplish that myself. Again, it wasn't exactly how I wanted it to go, but I'm grateful for how it did end up, because ultimately I was okay, my baby's okay, and we were able to do some great things together, things that I never dreamt that I would be able to do. So don't ever count yourself short, and just know that there are people like us here to support you through the process. So I just wanted to give a quick shout out to my team. I love these women. They are very near and dear to my heart, and without them, we could not support the moms that we do pre and postnatally. Dr. Carrie, she's been with us for nearly 4 years. She's an excellent prenatal and family chiropractor, and everyone just loves her. Anna is our massage therapist who's been with us for a few years as well, and she definitely has those magic hands and certified in prenatal, and it is such a wonderful thing to be able to relax and just be at peace. It's just another tool for you. We have Miss Andrea. She is our office manager. She is the one that keeps everything going like clockwork. And finally, Amanda, she's newer to our team, but she is a beast when it comes to organization, but her whole demeanor, it's hard not to be at ease. So these are the people that help make it happen. And again, just like I use them as our support, as a whole to be able to serve the community, you need to build your A team to be able to accomplish what you want. We get asked a lot about what the Webster Technique is. We often get referrals from OBs and midwives and doulas for the Webster Technique. So the one thing I wanted to make clear is it is not a baby turning technique. Often we will get referrals for breech presentation or just fetal malpositioning, and the success rate of baby assuming a proper birthing position is pretty high with this technique. And the reason for that is it's very specific. It removes the intrauterine constraint, because you can imagine if you have more stress on any side, it's going to make it harder for that baby to grow and stretch and develop and do what it needs to do, because at the start of that 3rd trimester, that's when the head is supposed to go down and engage, and then you want them to stay there. It's a very non-invasive approach. They've done studies on the Webster Technique. It does boast about an 82% success rate of optimal fetal positioning as compared to external cephalic version, ECV, which is at about 50%. In our office, we're at about 88%. But it's very non-invasive, it's pain-free, and these adjustments allow the baby to assume an ideal position because we are balancing and creating room in that environment. And it's pretty effective. So all in all, it is a technique that we're proud to be certified in, and we use it a lot. We also use a portion of it in the postpartum period, because that 4th trimester is just as important. Birth is one piece. Motherhood that follows is equally important. So a little bit about chiropractic and pregnancy. So why go to a chiropractor when you're pregnant? If it were up to me, knowing and acknowledging that this is one of the most critical points in a woman's life, it is in your best interest to make sure that your brain is effectively communicating to that uterus and every other part of the body. There's so many changes that are happening week to week for 40 plus or minus weeks that we do need that support. None of us are perfect. None of us assume perfect posture or have zero stress or eat pristinely all the time. So we do need a little bit of balance in our lives. So how I can benefit mom is, yes, it does prepare for a great environment for baby by balancing the pelvis, and the pelvis is the foundation of the spine, and the spine is an extension of the brain. And that's dually important because your brain and nervous system controls every other system of your body, to include your reproductive system, your digestive, your hormonal, your immune, all of that. It removes tension on the ligaments that support the uterus and allows, what do we all want, moms? We want an easier birth, we want a shorter birth, and we want less pain. I mean, yeah, I know I wasn't the only one, right? So we know that if we can achieve more of that balance, the likelihood of the interventions goes way down. There's more room for baby to develop. So it includes the cranium and the spine and all the skeletal structures. And ultimately, it allows the baby to move into the best possible birthing position. And with doing all of this, this is going to reduce things like a failure to progress and those interventions that we spoke of and the risks that come along with it. So this is just a quick recap of that, but ultimately, what is the result? Happy, healthy baby, decreased birth trauma for baby. It doesn't matter if it's the most natural of water births. It's tough being born. It is intense. It's tough for mom. It's tough for baby. So the fewer interventions that are going on, the less stress that gets stuck on the nervous system, especially for baby coming out on the other side. We need proper nervous system function in order to initiate and to continue labor. And as we mentioned before, the brain and nervous system, they're the master controllers of everything that goes on in your body, not just the musculature that is going to initiate contractions, but all the organs and glands working in unison. And we know that if we have stress on the nervous system, that can appear physically, chemically, mentally, emotionally. All of those create a state of inflammation, stress, cortisol, all of those things, and they shut down the calming process or the calming side of your nervous system, which is important during labor especially. So that stress causes dysfunctional input to the reproductive organs and therefore the hormones that initiate labor. So if you remember, we spoke about that oxytocin. So it only makes sense that if you have excessive stress or stress hormones, they can inhibit labor via disrupting oxytocin altogether. And this is not just, okay, you were stressed out during your entire pregnancy, but it could also be one big stressful moment. I'll give you some examples because a lot of us are thinking the worst. Yes, it could be maybe separating from your partner, but it could also be you moved to a different state, or you haven't been with work, or you are raising another little one at home by yourself. It's not, some of them don't have to be as drastic, but just knowing all of these things accumulate over time. And we need everything communicating on all cylinders in order, again, to be in that state of ease and allowing everything to progress the way you want it to. Obviously, when the body's not at ease during delivery, you end up surrendering control. So instead of surrendering into the process, which can be hard, and the best analogy I can come up with is going in, let's say, for your first deep tissue massage. In the beginning, it's going to hurt. We're going to try to fight it. But then when we breathe through that and we just kind of let it happen and surrender to it, we're still in control. When we continue to fight, we surrender our control. And that's what we're trying to avoid, because by surrendering control, the more traumatic the birth. And that very upper neck area, the cervical spine, has so many receptors that are responsible for processing the information from our environment. And it's it's crucial. Babies can't hold their heads up, in the very beginning, and there's a lot of input happening in this area. And this is the most common area of the first signs of damage when we have a rough birth. So again, what's at stake? What are the most common reasons why we will see kids in our office? And these are all things that we try to talk our way out of, to say, hey, it's normal. My neighbor had this, my sister's kid had it. Colic is not normal. It's not. It's very common for sure. But the ensuing sleep issues and reflux and constipation and favoring one breast while nursing, or starting to get flattening on one side of the head, or torticollis where they're stuck in a certain position, or they start to progress into ear infections and respiratory issues and croup and asthma and all of these things, allergies, eczema. And then we start to see that developmental milestones are being delayed or missed altogether. These are all compounding. We're growing into these various things. And the longer you have stress on the nervous system, the more work it takes to unravel that stuff. But it can be done. But this is what we're trying to avoid. When we envision holding our babies and becoming moms, we are envisioning not being in a state of survival, but we want our kids to thrive. We imagine them playing. We imagine them being happy and laughing and not being sick. So when we look at the reality and what the statistics are these days, we have to be asking ourselves, what can we be doing proactively to do the best that we can so we can minimize this stuff? Balance. Balance is key, right? Especially the first 3 years of life, there's so much development that's happening. The immune system doesn't get fully developed until around 24 months old in babies. So we know that, yes, physical stress is something we got to look out for, during the prenatal stages and labor and delivery. Chemical stress, what we're exposed to, how we're eating, our environment. Emotional stress. Are we anxious all the time? Do we feel not supported? Are we fearful of birth itself? Or, whatever the case may be. The key is we have to continue doing what's best, what's going to serve ourselves. And one way is to get checked. And checked, we are going to get into in a moment, from our lens as pediatric and prenatal chiropractors. How do we have a look under the hood? How do we evaluate the nervous system to let you know what is and what is not? A lot of evidence suggests that some form of relaxation, it doesn't matter if it's an Epsom salt bath, for 20 to 30 minutes. Magnesium is very calming, and that is what Epsom salts are. But it could be meditating, it could be prayer, it could be reading outside. We all have to have, I really want all of our moms to have three good ways to counterbalance stress. The idea of pure balance, it's like a unicorn that we're chasing after. The real key is counterbalance. How can you adapt in situations of stress? We're going to get into choosing your team and how you can continue to take the wheel and be the captain of your own ship. So these are things that we alluded to in the very beginning. These are all things that you're probably aware of. How many are you actually doing on the regular? The key is going to be consistency. Are we going to fall off the wagon here and there? Yep. We're human for sure. But just knowing that all of these things have been shown to increase ease and balance within your nervous system to support the end result that you were going for. Movement is life. And especially during a time like this where, people are being quarantined or, now there's more fear around all of this, we still need to get moving. People are cleaning their houses more, they're cooking more, they're trying to go on walks with the family. So whatever it is for you, you need to get good oxygen to the lungs. You need to increase movement. I mean, yes, we have a lot of relaxin hormone that's making everything unstable, but we still need to put good stress on the body. Physical preparation allows for a greater release of endorphins, and endorphins mask pain. So we want that sucker kicking in during labor. Exercise has been shown to reduce stress and anxiety, which we can all use right now. It prepares the body for delivery, and prenatal exercise is going to be different than everyday stuff. So case in point, HIIT exercises, so high intensity interval training, is not recommended during this time because it's going to put undue stress to a less stable anatomy and physiology, because again, week to week, your body is changing. Your center of gravity is changing. It's not going to support you through these types of exercises. But exercise, appropriate exercise, is going to lead to a faster postpartum recovery. So a lot of people ask us, what do you recommend? If you've ever heard of Birth Fit, we do have a local chapter in the area, and we can connect you to the owner, but this shows you to basically train for birth. I love it. It just made me want to get pregnant again just so I could experience it, but I fully and wholeheartedly support this mission because this wasn't a thing that always existed, but it's available now. But the risk of preterm labor goes way down, and it lessens stress on your body as a whole, which can obviously hinder delivery. So we talked a lot about mental emotional stress, we talked about physical stress, chemical stress. This is probably the one time in a woman's life that she's really going to start paying attention to what she's eating, because she understands that she and baby are sharing that space and they're getting exposed to the same things. But also, if you are able to, or if you're not pregnant yet, that preconception period, at the least, we should be prepping 3 to 4 months before we plan to get pregnant. Ideally, if you can go 6 to 12 months, even better. And one thing that I recommend for anyone of childbearing age is everyone should probably be on a prenatal vitamin. About 50% of pregnancies are unplanned, and sometimes we don't even know that we're pregnant until week 5, maybe, or 6. And the midline structures, like the neural tube, those are getting developed in this early stage. So if we're missing that window, we're not getting the proper nutrients there. So things like lip and tongue ties and some of these other midline defects can result, and then that will impair function down the road. And of course, we want great building blocks for our babies. Now, there was a common myth that there was a placental barrier, and studies have shown that when they looked at umbilical cord blood, that there were 287 chemicals. 75%, 217 of them, have been shown to be toxic to the brain and the nervous system. So it does matter what you're breathing in. I mean, thinking about now, yes, we're indoors more. It's supposed to be springtime, and so yes, it's allergy season, but now that people are stuck home more, I mean, sometimes the indoor air is more toxic than the outdoor air. Think about the off-gassing of, newer carpets and furniture and mattresses and these types of things. Sometimes it's our cleaning products. We're cleaning more now. So we want to use things that aren't going to be toxic to us, because whatever you're breathing, applying to your skin, that all goes on the inside. It does cross that placental barrier. And a wellness diet, we simply mean just eat real food. And just know that if you're doing great 80% of the time, that 20% when you get that funky craving, go for it and don't stress about it. But nutrient-dense diet is so important. It's packed with, I don't have to tell you, vitamins and minerals and antioxidants, and that's so important, especially during a time when we need our immune systems to be kicked in on all gears. We want to be sticking with real food, organic when possible. There's the Dirty Dozen, if you've ever heard of them, which are going to be the top foods that are highest in pesticides. So those are going to be the ones you for sure want to get organic when possible, and making sure that you're doing a good job of washing your fruits and vegetables. So when you look at some of these things, all of this makes sense. Prioritizing healthy fats, that's building that baby's brain. We know that the brain and nerves, they survive on the healthy types of fats. So your avocados, your nuts and seeds, if you can tolerate them, that type of thing, olive oil, fish, those are all great things. I know we don't have to talk about why you should avoid additives and dyes and things like that, but caffeine is a common one that comes up. And there are a couple of reasons why caffeine shouldn't be just part of the diet. And mainly because caffeine is going to overstimulate the adrenal glands. Those are the stress glands of the body. They're the ones that are going to be responsible for manufacturing up to 50 different hormones in your body, of which control your sleep at night, your energy during the day, blood sugar in between your meals. Super important. Not only that, it can dehydrate you. It's going to decrease the amniotic fluid. So when you're going in for ultrasounds, that's why being well hydrated is a good idea, but we don't need anything else accelerating that fight or flight response. Of course, when you are eating during the day, you want to have some healthy snacks on hand. Again, preparing. Success favors the prepared. So always have some good snacks, whether it's in the car, at home, in your purse, what have you. Be prepared so you don't get hangry and take it out on the ones that you love the most. All right, so in this final section, just transforming your pregnancy and the health of your children, we want to put this all together. Taking the wheel. Education is great. We want to apply the knowledge that you're learning today and just taking a step, and every day is a new day. Start reaching out to who is going to be part of your team. It doesn't matter where you are in the process, but we are here for you. We have resources for you. So again, don't feel like you have to navigate this alone. That's probably the worst thing that you can do. Having a plan in place, but just know that you may need a backup and you have to mentally prepare to be able to adapt and pivot if needed. And of course, staying focused, keeping your eye on the prize, keep looking at what you want, and maintaining balance as best as you can. It's not going to be perfect. It's not meant to be perfect, but you have to balance out the good with the bad. And again, just do the best you can and go forward. So in mapping the journey of your birth, don't let anyone else take the wheel. Don't let anyone else tell you what you should do. And I really hope that what you took from this is, okay, I like aspects of this and this. So this is what I want. This is what my partner and I have decided. This is how we're going to get there. It's one thing to name it, but you need a plan in order to get there and to achieve it. And what's the end result? Happy, healthy children. And we want a quick postpartum recovery. We want to come out of this better and stronger than ever. And it really does take a village. I would encourage you, if you don't already follow us on social media since the beginning of the year, every week we have been launching a new video where we've collaborated with another provider in the community. A lot of them are birth-related providers, and we really just showcase and highlight them so you can have a better understanding of what this type of profession does. And I'm going to stop the share button here. So what these professions do, but just know that we have so many awesome local people in the area that are ready and willing to work with you. The really cool thing is with the scanning technology that we use in our office, as I mentioned before, we're really able to make the unseen seen. Again, this is probably the most important time in your life that you should be getting checked by a chiropractor. Ideally, if you can start during preconception, great. If it's first, second, or third trimester, all good, all safe. But one, we need to get a baseline for you as far as, do you have stress stuck on the nervous system? If so, where is it? How severe is it? And having someone that can help guide you along this process and see you through. Because in the end, what matters most is your health and your happiness, and more importantly, that of your baby. If that sounds like something that you want to check out and pursue, please reach out to us. Direct message, call us. We are still open during this crazy time that we have going on in this first part of the new year. But just know that we're here for you. We want to support you, and we thank you for tuning in. But ultimately, you have to make the decision on taking the next step, because everyone can have and deserves to have the birth that they desire. Thank you so much, guys. Take care.